Hello, hello, hello to everybody here. It's Teresa Sanderson. As always, super excited to connect with you today. You can see I'm in this beautiful space. First of all, I'm in Arizona at my son's home, and I'm working from here right now. And just one of the many blessings that I enjoy since I've started my business and the journey of nurse entrepreneurship. But today we're talking about 5 ways that nurses contribute to the community. So I'm excited because we're moved into Nurses Month now and starting up Nurses Week. And so I want to celebrate some of the many things that nurses do to promote the health and wellness of our communities. So first of all, number one would be health promotion, right? Nurses every day are involved in things like health fairs. They work in public health. They do health screenings, a lot of education in those environments, all toward, promotion of community health and public health. So if you're working in the public health space and you hear this message, you catch this video this morning, know that I salute you. Thank you for everything that you do, for supporting your community in that way, because it is valuable, valuable work that you do. And I really want to just give you a big shout out today for those of you who are working in health promotion, public health, doing health fairs, health screenings, lots of health education on that community level. Thank you so much for all you do. The next thing I want to chat about is chronic care management. Now, this is a relatively new and kind of trending nurse entrepreneurial venture, but also a way for nurses to start businesses working collaboratively with physicians to improve the chronic care management that patients are receiving in the community. So I think we all know that unless we have a complaint of pain or have something that is seriously wrong, that many times a patient will not go to the physician's office, right? So chronic care management works as an extension of a primary care physician's practice to continue more in depth, more in detail follow-up and management of those patients in the home and community setting to guide them to resources, to give them a lot of education and training on when to contact the doctor, when to go in, and how to manage their illness in the most positive way. There's a lot of teaching that goes on in that, as well as a lot of motivational interviewing and working to inspire and motivate these patients to achieve their own health goals. So for those of you who are working in the chronic care management space, thank you for all of the work that you do, because this is an amazing way to support not only primary care physicians in providing excellence in patient care, but also for serving the community on a much deeper level. So thank you for all you do to help those with chronic conditions. Appreciate you. Next, I want to talk about home care. Oh my goodness. Home health care has been around for a long time, and there are many nurses who would do nothing else. So these are nurses who go out into the community, see patients at home or the location that they call home, and they provide skilled care for patients who've maybe been discharged from the hospital after a surgery or after a serious medical illness. They do a lot of wound care, dressing changes, lots of supportive care and teaching, and help patients successfully transition from the acute care setting back to home. So I know that this is very near and dear to many patients and families' hearts. I think we all know that if we could do it, we would much rather receive care at home in that place where we feel safe and feel like we belong and are most comfortable. So for those of you who are working in the home care space, I want to thank you for just being a part of those patients' journey and being willing to go forward into the unpredictable world of the patient's home setting, where there can be anything from dogs to family dynamics that maybe are a little unstable and a little unsettling. It's a very different environment working in the home setting. And so for those of you who go out there and do that every day, thank you for the work that you do to support those patients at home. Next, I want to give a shout out to all of the nurses working in their communities as hospice nurses. Thank you for what you do. These patients and families are at a very vulnerable time in their lives, and they're counting on you to help them, support them, teach them, coach them, and mentor them through this end-of-life process. Even though end of life is many times expected, it's still something that's very, very painful and very difficult for families to manage. And it's very unnerving, and they can feel very afraid and as if they don't know what to do. So for all of you who are working in the hospice care space, whether that's at home, maybe even in a hospice house type setting, a hospice facility, or even in long-term care facilities and other spaces, thank you for what you do. One of the many things that hospice nurses do, and they do very well, is advanced care planning. Most of the hospice nurses I know are very, very comfortable with uncomfortable conversations and helping patients and families navigate the difficult choices that are required at end of life. So thank you for doing that, and also for the wonderful work you do in helping patients and families manage symptoms and pain. Vitally important for the end-of-life care experience. And so I want to give a big shout out to all of the nurses who are working in hospice. I think those of you who know my history know that I am an old hospice nurse, and it is probably my first love in nursing. But thank you for all that you do. Lastly, I want to talk about concierge nursing. And believe me, there are many more than 5 ways that nurses contribute to their communities. But concierge nursing is something that is relatively new, and it's become a way for nurses to take their nursing career really by the horns and decide how they want to show up as a nurse. And so concierge nursing allows nurses to work independently and serve patients in the ways that they choose, working under their state Nurse Practice Act. So nurses can fill medication boxes, they can complete patient assessments, they can help patients with their ADL care, they can help them with general estate situations. There are so many different things that concierge nurses are doing. They can accompany patients to appointments, schedule appointments, communicate with physicians, coordinate care. So many different things that concierge nurses are doing, and they do it on an as-needed and kind of a la carte situation. But again, just making our profession of nursing much more accessible to patients who are in their own spaces and wanting to live on their own and live a very high quality of life. So this is just one aspect of nursing, working in the community. And so for those of you who do that, as we step into Nurses Month and Nurses Week, I want to celebrate all of you, each as individual nurses, for all of the experience and expertise that you bring to the table. Thank you for your contributions to our profession. And if you haven't heard about it yet, just know that Nurses Feed Their Young has put together a gift for each and every nurse, and it is a 30 contact hour nursing continuing education bundle that is our gift to you. It is a small token, but we wanted to find a way that we could recognize every nurse and show you how much we value you and how much we appreciate you. So this is totally complimentary. Click the link below this video so that you can access the very first annual Nurses Feed Their Young educational buffet that's going to provide you with 30 contact hours of nursing continuing education at no cost. And also, just so you know, those topics that we're covering at the buffet, you're going to learn some clinical things. There's a section on entrepreneurship, a section on leadership, and a section on self-care. So I hope you'll find the information valuable. It's our gift to you just to say thank you for all the wonderful work that you do each and every day. Thank you for tuning in. I'll see you next time. Bye-bye.